Good morning, Mary.
Hi, Sarah. How are you?
I'm doing well. Just survived the first day of eight. Not that it wasn't already started long before that, but yeah. How are
They
you
said
doing?
it's going to be wild this year.
Yeah, just a little. I know everybody's getting logged in.
Yep.
I'm like, who keeps doing these 8 a.m. webinars? Oh, right, it's me. Only time left that's not booked in my schedule, so you kind of got to go with what you got, right?
That's exactly right.
Good morning, everyone. We have several still logging in, including our legislative team. So I'm going to go grab some caffeine and I'll be right back with you, okay? We'll get started at 8.
Hello, I'm Jessica Brooks Woods, CEO of the National Association of Benefits and Insurance Professionals. Millions of Americans rely on their trusted health insurance brokers to navigate the complexities of the healthcare system, secure the coverage they need, and ensure it fits their budgets. That's why I'm thrilled to announce the launch of NABIP's new campaign, Brokers Making a Difference. This campaign highlights the central role NABIP brokers play as the ultimate allies for healthcare consumers. From seniors and families to individuals and small businesses, NABIP brokers are more than professionals. They're advocates. They're trusted advisors who bring clarity and compassion to an often confusing healthcare system. In a time of rising costs, misinformation, and complex choices, NABIP brokers provide something invaluable: peace of mind. They're the ones helping small businesses offer meaningful benefits to employees. They're guiding families through decisions about their health, and they're empowering individuals to find coverage that protects their needs and fits their lives.
Good morning, everyone. I got the time as 8:02. We're going to go ahead and kick things off today. Welcome to the third Thursday of the month. I mean, that snuck up on me pretty quick. Uh, I hope you're all doing well. And I know we're a day into AEP for folks that do Medicare and in the midst of chaos for everyone else as well. So thank you for carving out time for the updates. I will be turning things over in just a moment to our Ledge team. First, I just wanted to remind everybody, I'm sharing my screen for our NABIP Brokers Making a Difference campaign. This campaign's been developed over the past year and has slowly been added to. So just a reminder for you brokers, agents, and people that are serving our industry that it's important for us to share our voice, our clients' voices, and we're giving you a platform to do that in addition to your normal channels. So I know you all probably have your own surveys you're asking folks to fill out. I know I do for their experience with you and your offices. But I would invite you and remind you to please continue to send out these requests. If you go to NABIP Brokers Making a Difference, submit your stories, takes you into these different surveys. And again, right now they are currently for Medicare and individual under 65 marketplace. Down the road, group, I'm sure, will be a part of this. But again, because of the legislation that's going on and all the disruption, this is the area of focus for the moment for these surveys. There are two additions for each. So you have one for brokers and folks who are in the industry, your testimonials of what you're seeing, what you're encountering. And then you have the beneficiary or enrollee testimonials. So each of these survey links you can click on. So if I wanted to send a follow-up or a blast out to my Medicare beneficiaries, I can click on this survey. It will take me into the Operation Shout. Yes, these are also on the Operation Shout page. To that action center. And that way, you're able to send a direct link out. They do not, no one has to be a member of NABIP to do this. It's open to our clients. It's open to counterparts in our offices and other professionals in the industry. So it's important for us here in Illinois to continue to collect these as well as nationwide, because as we go through the season, the documentation is key, right? And NABIP is putting together and aggregating these comments and feedback to provide to our elected officials. Recently, we did ask for the Illinois surveys to be pulled, and unfortunately, they were very few and far between. So we need to make sure that we're not just sharing surveys with 5 responses. So this is my plea and reminder for everyone to please go out here, share this with your folks as you have time, do a blast, put it on your social media, text somebody, even if you can each get 2 people to fill this out, that would be wonderful. And again, we really need this information and these surveys so that we can share um, the importance and the value of how we all work together in the ecosystem for healthcare. So with that, I'm going to move things over here to our slide deck. We do not have a sponsor today and therefore no CE credit for this segment. But that's all right because we have some awesome updates. So be sure to tune in with us. And because my voice likes to go in and out in the morning, I'm going to ask you, if you so choose, to please unmute and help me with the Pledge of Allegiance. Stand and help me with the Pledge of Allegiance. Thank you. Pledge allegiance to the flag
Flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with
With-
liberty and justice for all.
Thank you. Now I'm going to switch things up for just a moment. I'm going to ask our presidents and local chapters to give us a quick update because I know we're all in a rush and I don't want them to miss their opportunity. Do we have someone on from suburban Chicago that would like to give an update for what's coming?
Good morning, it's Carrie. So we don't really have a whole heck of a lot going on outside of our normal meetings. Our normal meetings are the second Wednesday of every month at Pleasant Run. Last week we had a really good presentation, or earlier this month, we had a very good presentation on level funding. And I'm not completely confident what our next speaker is, but I can tell you it will be good because this year we really knocked it out of the park.
Thank you, Carrie. And you guys have a fundraiser coming up, right? Your annual philanthropy holiday drive?
Oh yeah, bring a toy, bring some food, bring some money, and I think a fundraiser instead of a fundraiser, Sarah.
Gotcha. Well, that's wonderful. Thank you so much. Heart of Illinois. Do we have someone on like to give an update?
I don't see, it doesn't look like Heather's made it this morning, but let's see. We have defaulted to the third Thursday update will be also our regular meeting. So we've moved it to the second Thursday next month. So I guess it's kind of getting ahead of ourselves here, but the next NABIP Pulse will also be in Heart of Illinois' regular meeting, I guess is one way of putting it. December, we don't have anything scheduled. Enjoy the holiday. January, we are working on a meeting that will be at another location. We're looking to go down to Bloomington in the Snyder Building for a group-focused meeting there the second Thursday of January, it sounds like. So that's what we've got going on.
Wonderful. Thank you both.
Mhm.
And I don't see Evan on quite yet. Gonna switch over to Missy's presentation. Bear with me 1 minute.
Are we ready? Okay.
All right.
All right, so we'll get into it here. I'm not sure if Evan's going to join us. We are in veto session. It was scheduled the 14th to the 16th this week, and I've not heard from him. So I'm sure we will have an update this weekend, probably with the goings on in Springfield. So we'll dive into this presentation, and a big thank you to Carrie. This is, she's created this presentation, and so gratefully I am that we get to use this for third Thursday, and we're a team here trying to keep up with work and provide these updates for folks. But of course, we're still in a government shutdown. That shouldn't shock anybody by now. And I really haven't heard in the news that I've been able to capture any talks of it ending soon. Still, I mean, we're freeing hostages and doing all kinds of other things. So um, it'll come around, I'm sure, here in the next couple of weeks. But on the group health insurance side, watch the recording of the webinar on the One Big Beautiful Bill and its impacts. The CBO is predicting a 3.4 trillion increase to the national deficit and raises the debt ceiling by 5 trillion. We've got Medicaid impacts over the next 10 years. It's a big topic of conversation. A lot of those provisions don't begin until 2027, however. And they're predicting 10 million more people to be without insurance by 2034. Employers should be aware of the ripple effects across the system. Hospital and facilities will be looking at this and looking to offset their Medicaid revenue. On the individual health insurance side, we did have a small victory here. If any of you do federal marketplace policies, you know that they limited our logins from 12 hours to 30 minutes. Here in my office, we did experience that. Heather was kicked off in the middle of an enrollment, actively in the system and kicked off because she hit the 30-minute mark. So we have had that rescinded, thankfully. So we went back to the 12-hour rule. And NABIP has provided an advanced premium tax credit resource toolkit to help people, communicate this to your members and explain to them what is happening with those premium tax credits. On the Medicare side, NABIP also has customizable Medicare flyers out there. They have done this in years past. I know I have used in the past the infographic that explained deductible and donut holes and all of that, the different phases of coverage for Part D. Of course, that's a lot simpler now that we don't have a donut hole, but those graphics still are out there for your use, and a lot of them are customizable. You put your information on them, so make sure you're checking that out and using the tools available to you. We'll jump into an update on the WISER model. So that's the wasteful and inappropriate service reduction model. They're looking to reduce Medicare spending, implementing some prior authorizations. Now it's limited to these 6 states that you see on the slide here. And there were only 17 service categories that they are choosing to implement this new program. I've got a link here that goes out to the CMS infographic, and we can provide that later if you'd like it, but it was on cms.gov. So you see here a list of the services that they're looking at. A lot of the nerve stimulators are there. It's supposed to be that these services are some of the most, we'll say, abused diagnosis codes that they're finding out there. So they have picked these 17, and we've got a few more on the next screen as well. But remember, it's just in those 6 states. This is a voluntary program right now, and Illinois is not in this, but it's something to keep an eye on. I find it ironic that we're implementing prior authorization in original Medicare and at the same time telling Medicare Advantage to knock it off. So yeah, we'll see how this goes. And I can't help but say WISER and not think of these guys. So I could be showing my age here, but this is, as I went through slides last night, about all I could think of after a full day of renewals is these 3 fellas and what they might think about the WISER model, huh? Yeah. Next slide. Illinois state-based exchange. I know we're all excited about this. There is a broker hour again today. If you're not too busy with 300 PDPs and 200 MAPDs and all of that. 11 o'clock, I believe, there is a new broker hour on Get Covered Illinois. You should have received an email if if you're already in the marketplace and have customers and had done your form. You should have already received an email to access your broker account. Literally, that's it. You can access your broker account, but the clients will not be there until November 1st. And this is just kind of the timeline that we are in. We're right here, obviously, in limbo. Clients have also received emails and correspondence saying they'll be moved and migrated over to Get Covered Illinois. I know I've heard from several of mine. Just have reassured them that we're still certified and we'll be able to take care of them much like we have in the past. Fingers crossed that I'm telling them the truth and that all of this works well come November 1st. And I've had plenty of conversation with GCI or Get Covered Illinois, and they're aware of a few things potentially to watch. Not that they will go wrong, but to watch, and they have game plans ready to roll if anything goes awry. So the broker line is open and available for questions, but again, they will only answer questions about accessing your broker account. The number is 866-349-7579. So you're welcome to call them if you have any problems with logging in or getting access to your account. And then after November 1st, obviously, that will be the dedicated broker line for any issues you might have with enrollments. I think actually, I'll take a quick pause. I know everybody's being very quiet and I'm yakking away. Are there any questions? Anybody have anything?
So Missy, I have a question for you. And yes, I was notified by my clients that they were getting these emails because they wanted to make sure they were legitimate, right? To claim their accounts.
Sure.
And I've had some folks that have had challenges with that because of one reason or another. Maybe their email when their account got set up was incorrect for some reason. I had one professor from the U of I that was part-time that got very upset because his email was spelled incorrectly and he was sure that he did not spell Illinois incorrectly because Illinois was the part that was misspelled. So I don't know, I'm curious if the transition process, maybe got monkeyed with some of these odd questions. I don't know. Have you guys experienced anything like that?
I have not yet. I've had some clients ask if they have to do it. And honestly, I've told them you don't have to. We're going to have the same broker access that we had before. I mean, I don't discourage people from going out and creating their accounts, obviously, right? But I know for the past 10 years, most of my clients don't go out to the marketplace and set up their own account. They come to us first. And I've reassured them that we can still do that. Carrie, what are you seeing?
Well, I was just going to say, I want to strongly encourage everyone to pull a report on their book of business for an audit after everybody is moved over, because we have no choice but to have faith and trust in the process while having no control over the process. So, Sarah, I don't think that the state misspelled Illinois. I think your client did. I don't know. I mean, we're all on this adventure together. And it's not Bill and Ted's Excellent Adventure. Well played.
It might be as weird, but not as fun, right? It looks like you guys have a question in the chat too from Susan.
I've not been able to get on GCI because of being the agency broker. I did call GCI and I'm waiting to hear from them. It has been a week. That's interesting. Yeah, because you should be able to be the broker and then designate yourself as the agency manager. It was the instruction that I had heard. I would call them back, Susan, for sure. You call that number that I just gave.
Missy, can
I'm
you
gonna
type
put that in
that
the
number
chat for everybody.
just in case, so everyone can have it? I know we got some folks driving in to work or to appointments. Thank you both.
I can't type and talk at the same time though, so bear with me.
And it looks like the preview for 2026 plans starts October 27th. However, I thought my understanding was we had two sets of rates, and depending on, you know, if subsidies are adjusted, not adjusted, you know, we could
Yeah, I
end up
agree.
with kind of a hot mess there. So have you guys heard any updates there?
Well, the only update I have is not from GCI as far as that's concerned. I mean, I think they would like to open window shopping the week before, obviously. But from my Blue Cross Blue Shield rollout meeting, they're issuing renewal packets with no rates in them because they don't know what the rates are going to be. They did share that they have a deadline that they're going to move forward, right? But didn't share what that date will be. So yeah, you're right. There's obviously different sets of rates filed depending on what's going to happen. I just don't know if it's going to be resolved by then. It's pretty scary, but you know, November 1st is going to come and we're going to have to move forward with what we know and what's available. But just be prepared to pivot midway through or even when it's over to do this work all over again if we have a different decision from the federal government at that time. You know, it was brought up for those of us that were in this market back in 2013, 2014. We didn't work in a 90-day time frame. We worked for months on months, and it took 2 to 3 years for things to straighten out. Now, I certainly hope that we don't have that with our Get Covered Illinois side, but this isn't a Get Covered Illinois problem either. It's a federal issue, right? So I know, and a lot of you are probably in the same boat as I do. A lot of small group policies, and they're all getting 20 and 24% rate increases, and they're looking at me like, well, can I do individual? And I'm like, you really don't want to look at individual this year. I can't even quote you right now. I have nothing for, you know, to compare, other than your network will be much smaller and you'll lose access to, you know, a national network. And usually that turns it off, right? But it's a struggle.
Yeah, you have to remember too, Missy, is think outside the box, right? So people say they don't want, they're just not gonna go, they're gonna go uninsured. They don't want to go through any of this. They don't believe in it. They're tired of the shenanigans. I think that we have to really be smart and look outside of the box, but with extreme caution and with very clear disclosures, right? So
Yes.
there are alternative products, and I know health share ministries are out there. There's some indemnity plans. They're not all created equal. But I think that we should encourage people to have something rather than nothing and just be very clear in disclosing that this is not Affordable Care Act insurance. The other thing is like this sucks for everybody. And there's never a good way to say, hey, come on over for dinner. By the way, I'm making liver and onions, right? But that's kind of what we're doing. And I think that if we can just exactly what I know you do, Missy, Sarah, what I'm sure you're doing, you know, is just assuring them that we are ahead of the changes. We're doing the best that we can to advocate on behalf of our clients and bringing them true stories and bringing our clients true products.
Right. I just encourage a lot of education if you're going to be presenting indemnity and some of those other products. personally in my office, I don't represent any of the health sharing ministries plans. Again, I don't discourage people from looking into it, but I caution them that it's not a true insurance contract, and to definitely make sure that they're checking out what they're getting into. Also, on the indemnity side, I mean, I've talked with other folks at that Illinois Healthcare Council. We talked about accepted benefits. Well, that's what your indemnity plans are. And, um, you know, Illinois went after short-term medical plans and said they were junk. Okay. I don't agree that they were junk plans. They were underwritten plans and they were there for a reason, but they deemed them junk and went after them. When do they do that? With accepted benefits? They would do that after they hear complaints about thinking that they had major medical coverage and they did not, right? So we have to do our due diligence to make sure that they know what they're getting into. So when July and August come and they've got a claim, that we're not getting complaints sent to the DOI on these benefits. I pointed out while I was there that it's interesting that they may look at accepted benefits as a junk plan when, the out-of-pocket maxes are going to over $10,000. What is it, $10,600? And you almost need an accident plan to go with that to be able to afford the out-of-pocket. It's the government plans that need these side benefits to be able to afford out-of-pockets. So, they need to wake up and see what's happening there.
Yeah, and I've been getting a guidance. I don't know if everyone recalls Shaylin Jackson. He's a compliance officer from SMS that several of us work with. And while they're specific to Medicare, he just said, hey, you can absolutely 100% put together, a client recap form, if you will, for lack of a better term, and have them sign off, just verifying what they are purchasing. And if you are selling a plan that's not ACA compliant, that certainly could be a form, that's created and signed off on for verification for your E&O, in case a complaint was to come in down the road. So to your point, yes, educate, do your due diligence, but then also, cover your butt. I do have some sample forms. I'm not a benefits attorney by any means, but I have some sample forms. I will share in a follow-up email some links to those in our Google Drive for you guys if you would like to take a look at it. One of which is, let me see if I can make it bigger on the screen, non-ACA acknowledgement form. I didn't create this again. And it just kind of recaps. You can use this as a template for sure if you'd like. And marking their reasons, and then there's a name to print and sign and date that. So there's also different variations some folks are using.
Do you want to share those, Sarah?
What's that?
You want to share that?
Yes, I'm going to send this in a recap. I'll do a follow-up email because all of the links you guys are referencing are fabulous. So I want to make sure everybody gets those. But I will put these in our Google Drive and make sure there's a link in the follow-up that goes out to everybody today, along with the recording from our call in case, we're all busy, right? Someone wants to listen in later, but totally cover your butt. And I created, I went a step further because those of us that are facing, potential cuts in our Medicare commission for all the work we're doing, I did make some adjustments to a different form. So like this form that I'm currently using, I've got the client name. I put my brand up here again. I can send you guys the open version, but it allows for you to put in all of the recap of information. So I think a lot of us do this in a sense anyway, whether it's in a follow-up email. But if you're going to be selling indemnity products, additional products, lump sums, things like that, it can be helpful to have this on here. And if you have a version of PDF, you can kind of edit these out too. Not everyone does LTC. I partner with Lori Martin on those when I have questions. She's part of our NABIP group and an expert if you need someone. And then I added a page 2 here and got it approved with Shaylin. And, again, it just kind of recaps everything. And it also has this I decline this coverage. So again, I know not everyone does Medicare, but these are some good examples, and I think we should all be sharing them to make sure, again, we're covering our butts. I know it's an extra step, but just having something that recaps your appointment, that's in writing. If they're not in person, I recognize it's not always feasible for folks to sign off, but I think that that's all part of the education, because for a lot of people, insurance is a completely different language. Just like if I was trying to sit down and read a law school book, it's not my language. I would need a recap from my attorney if I had a homework or an assignment to make sure I knew exactly what I had.
Well, and I think, and to your point, I think it sums up your appointment, which is great. They don't remember the 45 minutes of jargon that we just gave them, right? And even if you can't have them sign off on it, just documenting that I have a copy and a copy was given to my client, and then right? And it's documented that they have this,
Right.
they know what they bought, what they have with us. So I think that last form I had put my eyes on, the one before that I hadn't. So it's great information, Sarah. Thank you.
Yeah, absolutely. And again, not created by me, but I'm totally utilizing these folks because
Yeah, they're nice pieces.
yeah.
So, okay, we can move forward here a little bit. I've got a little bit of a few slides on state updates. So as I said at the beginning, we are in veto session. So I'm not really surprised that Evan couldn't make it this morning. I picture him hustling all over Springfield this morning and trying to beat off all the bad guys, right? He's out there with his sword defending us. So 14th to the 16th this week, and the end of October, the 28th to the 30th. Purpose here is to review any bills that were vetoed or amended by the governor and address any unresolved or emerging policy issues. On the this kind of a side note on the medical insurance related issues, we did have a PBM reform bill passed last spring, and they did come out saying they will not release any guidance on that PBM bill. And I don't know if you've seen any news from your carriers, but they're all trying to interpret then based off the original language. So we will have to see how that comes down on the fully insured side anyhow, how that's going to play out. And then your larger groups, again, no guidance coming. So you're on your own to interpret this apparently. So, but if we have to push back, absolutely. We can make sure that your voices are heard and relayed back to Springfield. So. Okay, couple things to watch, and Gary, you might be better at this piece than I. We got a mass transit bailout. So in the spring, they had introduced this $1.50 delivery tax on all home deliveries and a service tax on your everyday services like haircuts and oil changes and so forth. And that was, to my knowledge, that the intention of that was to fund Chicago's issues with their mass transit. Is that how you understand it too, Carrie?
That is what they're saying.
Okay.
I don't believe that's what they're doing, but yes.
Yeah. I don't understand what you're saying. No,
Kind of.
could be talking about a green energy package. Proposals include a surcharge on your electric bills, loosening the nuclear power restrictions, and new energy efficient mandates. Rising utility costs, risk to manufacturing jobs, and loss of investment is the criticism there. So those two things, if something pokes its head up during veto session, those are the two things that we wouldn't be surprised, I guess you would say, to see pop up. The bad thing about veto session is it's so short. if something comes up, they run with it. And there's not a lot of time to debate it, fight it, etc. So the Republican view here on our budget shortfalls and spending, the Republican view is the blame, placing the blame on the federal government is unchecked and a deflection of what's really going on in this state. The governor's response has been an executive order to identify the spending cuts and reserve 4% of agency appropriations and limit the non-essential spending and hiring. So he just continues to overspend, and it's everybody's fault but his. I'm sorry, that was biased. I shouldn't have done that. Laughter is the best medicine. So doctor told the patient you have acute appendicitis, and the patient replied, is it better than an ugly one? Yeah, thanks, Carrie. All right, that's really all I have for today. If we have any other questions or discussion, feel free to unmute.
A couple of quick updates for those that are working in the Health Alliance medical plan markets downstate real quick. So Health Alliance sent out several notifications throughout the year, of course, to members stating that they are closing and their plan will be terminating at the end of the year. There were some variations of this that went out. There was a printing error. So there was a see the attached flyer for more information, and there was nothing attached. So that had an influx of calls there. So it's nothing to freak out about if you have clients asking you questions about that. Just reminding everyone that you do have an SEP with these folks. So, if you're overwhelmed like the rest of us are, you actually have an extended period to see these clients that are affected. I know everyone wants an immediate, resolution. It's scary when you've had an insurance company for so long. It's been local, and now they're having to find something new, some of them after 45 years. So I just wanted to remind everyone that you do have that SEP for an extended amount of time, particularly when you're working with all your Medicare clients. And because they're losing coverage due to no fault of their own, whether they're on a Medicare Advantage plan or a Medicare Supplement plan with Health Alliance, that SEP is good. So if you've had someone on a Medicare Advantage plan only for years and years with Health Alliance, they still have an opportunity to go back to original Medicare and get a guaranteed issue Medicare supplemental policy. You would need to attach a copy of their letter of termination from Health Alliance. If they did not keep any of those letters, they can call the customer service line and request a copy of their letter of termination to be sent to them, and they will mail them a fresh copy. So just, I get a lot of these questions down here, and I know sometimes you folks are getting the same ones, so I wanted to cover those bases. Particularly focusing on Champaign County in East Central Illinois, where Carl, Health Alliance's mothership, is located. Although they did make the announcements in February and June, contracting with hospitals and clinics, as most of you know, takes a long time. So what has occurred here with Carl specifically was WellCare and Humana did get approved contracts from Carl, but they did not get it until the 11th hour. Medicare.gov, when you are using that, and of course that's the source of truth for all of our systems, is not going to show that Humana Medicare Advantage or WellCare Medicare Advantage has Carl doctors or Carl Clinic doctors in the search results. That's problematic for all of us, right? So I wanted to make sure everyone's aware in case you're working in this area or have any clients that are going to Carl. So after powwowing with my old Health Alliance management team, we identified a plan for Champaign County specifically that was as close to the POS Choice RX as possible. It is a WellCare plan. And we believe they specifically did look at the POS Choice RX, which was a top selling plan in that market, and really sharpened their pencils and gave it their all. But again, it's not going to show the providers in the network when you do the regular search. So that's where we come in as knowledgeable agents and brokers. The Carl Hospital website, Christie Clinic website, OSF websites, remember they all have links. And if you follow me on social media, on Facebook, I shared those on their websites because of these problems with providers not showing. And we just went through this exercise in July because a lot of Health Alliance groups, commercial groups moved and not all the contracts were updated. So again, we just went through this exercise in their market. But if you go to their websites, look for insurance accepted for that to be documented in black and white. And again, reminder, you have that SEP. So in talking to our WellCare rep at Kits and Coffee, hosted by NABIP part of Illinois, they recognize, hey, we are available. We know that it's not being reflected in the systems. Just remember that you do have that SEP, right? So you have an extended amount of time and you have the OEP. So if you have someone who's a high utilizer, you may want to consider in these particular markets options and go over those with people. I'm just very honest to say, for a lot of my folks, the Aetna Medicare Advantage plan that's in Champaign County is your safety school, for lack of a better term. The doctors are a network. It's not as competitive of a plan option as what the POS Choice RX was with Health Alliance, or that the newer WellCare version is of it for 2026, but your doctors are showing a network. I'm always cautiously optimistic anytime a provider is only posting vague information about accepting a plan. I don't know about you guys, but after 20 years working in the business, you sometimes will encounter, oh, well, we're only taking the specialist or we're only taking the primary care doctors. So, take it with a grain of salt, screenshot it off of the page, but make sure you're educating your clients again. And remember that you have that extended SEP and you do have OEP. So if someone was to enroll in a plan because they either didn't know, their agent didn't know, you didn't know, and then they find out, hey, my neighbor has this excellent WellCare Medicare Advantage plan. Again, just reminding you about OEP for first quarter. And of course, we can't advertise that, but as we're having our client one-on-ones calls, please keep that in mind. And I know it's a bit wild in some of these markets, but I wanted to point that out for folks because if I'm getting the questions, I know some of you probably are too. All right, I hope that helps, guys. Yeah, I know Mary feels my pain. Any other questions for the good of the group? You can put them in the chat or unmute.
Yeah, I do have a question. So were you just saying that the Carl doctors and hospitals aren't showing for Humana and WellCare?
They will not show on Medicare.gov until January, according to the
Okay.
Humana and WellCare reps. However, they are in network according to the Humana and WellCare reps and according to the Carl Hospital website.
Okay.
And so I just caution you, again, take that with a grain of salt. We absolutely want to be optimistic that that's all going to go through without any problems. But
I want to just jump in and add my 2 cents real quick because I had a really interesting conversation with Humana about this. And the reason why, Sarah, I'm not sure if you're aware, it's they have to suppress them because if they have a wrong list published, they get a penalty, a fine of $20,000 a day.
yeah, and I'm being told that the list will show in January is what I've been told, Carrie, by the reps. Is that what you're hearing as well?
I'm hearing that once it's correct, once they can validate everything, that's when it'll be published.
Yeah. So again, our messaging, our disclaimer is take it with a grain of salt. If you're seeing it published on the website of the provider, but it's not showing up yet in Medicare.gov, and just be prepared with your SEPs and your OEP options in case you have to pivot.
What about like Physician Finder or Sunfire if you're using those options? And
It
you're
all
going,
pulls from Medicare.gov, so those Carl doctors are not going to show up for WellCare or Humana.
okay, thank you. Did not know that. Thank you.
You're welcome. I've also had some trouble with some Christie docs and OSF. So just, again, I went through this exercise earlier this year. With all the calls from commercial groups, because I was with Health Alliance 18 years, so I had a lot of folks calling, but you got to be careful. Don't be afraid to call the billing department at the hospital or clinic as well, and see if they can give you something or point you to the updates on their websites. But these commercial groups, I know there was really a lot of confusion with all the plans, is particularly with the state employees, right? I don't know if any of you, I know we get questions from people who are like, I know you don't do this for the state, but I have questions. I want to make sure my doctor's in network. So I get those all the time. All right.
We got a question in the chat about CE credit for today. And yes, not having a sponsor is what holds us back from filing the CE for this hour. I will share that we do have a sponsor for November's meeting, which is 8 to 10, actually, a 2-hour meeting. Because it's our legislative meeting, our big legislative meeting in November, and it is being sponsored by Blue Cross Blue Shield. So we will have CE, and it's already been filed for our November meeting. But thanks for asking.
And remember that third Thursday, we're moving to the second Thursday for November. So
November 13th, I believe, is our date.
November 13th. 8 a.m. So that will be our annual legislative update, for lack of a better term. And I apologize for all the switching, but there's a lot going on, and I know last year we moved it to the first week of November. So we appreciate you guys and apologize, and I'll be sending out a recap email, like I say, with all these reminders. Try to help keep us straight.
Yeah.
But yes, Michael, if you know of anyone that wants to sponsor a segment, it's $100. And that basically just covers our CE filing fees and CE credits for those who attend. So if you know of anyone that's interested in sponsoring any of these segments, I sponsored one myself when I opened my agency. Please send them my way, and I'd be happy to help plug them in. Thank you all. I'll hang out for a minute in case anyone wants to stay on and ask any other questions. You guys have a wonderful day.
All
I'll
right.
be sending
Thanks,
out a
everybody.
email.
We'll talk
With all
soon.
the links from your presentations. Wonderful presentations. Thank you, Missy and Carrie, for all your work.
That was scary, except for the Budweiser frogs that show my age. Have a good day.
You too, guys.
Okay, so I just have a quick question since you're gonna stay on.
Yeah.
I kind of joined late, and so I'm new into the ACA market. So it's
Yeah.
Get Covered Illinois now, right? And how do you get contracted or certified with them?
So Get Covered Illinois, we
Mhm.
really are on our second year. We're transitioning from the federal exchange to a state-based exchange. But the first year, you have to basically just mimic and keep everything the same. Give
Okay.
them time to run their RFPs and all of that and identify the platform they're going to use, things of that nature. But yes, we are transitioning over to state-based exchange for January
Right.
1st effective dates. The calendar, and I will put this in the email follow-up as well. There was a rollout calendar Missy had slides on. We should be able to start previewing
Okay.
October 27th, 28th, but you can absolutely go out there today and set up your broker website.
Okay.
Have you already done the training?
Not yet. I have to get the training done. And now
Yeah.
is that on Mark's? Is that on the Mark site still?
No, so for Get Covered Illinois with state-based exchanges, they actually have completely separate trainings you have to do. So if
Okay.
you're going to do other states, you still have to do the federal FFM training as well.
Okay.
But
Okay.
specific to Illinois, we have a completely separate training, as do other state-based exchanges.
Right. Okay.
So let me pull that up. Let's see here.
Now, is Blue Cross Blue Shield the only one left in that's gonna be in Get Covered Illinois?
To my knowledge, for downstate, that's correct statement.
Yeah,
Yeah, Chicagoland will still continue to have options, according to what I've been told.
okay,
But for downstate filings, the only one I'm aware of that's filed is Blue Cross Blue Shield of Illinois.
okay,
Now they'll have multiple plans, to my understanding, bronze,
right.
silver, gold. I have no idea what those plans will look like, unfortunately.
Okay.
But yeah, if you go to Get Covered Illinois, are you
Okay.
on your computer now?
I'm on my phone, but I'm on my phone.
There is a
But yeah, I can get to my computer. Is there a site? I'm sitting next to it.
yeah, let me do this. I'm gonna find because there's actually another call today specific to Get Covered Illinois.
Oh, is there? Maybe between appointments I can try.
Look and see. You have until October 17th to get
Ooh,
your information done. So if you go to the chat and click on that link, it will take you to the page, and if you scroll down to the middle, it says to get started, log into the Get Covered Illinois Learning Management
If I go
System.
into the chat.
You don't see the chat?
I do. I'm looking right
Oh,
now. No, I don't. Um, Chat. Oh, no, there's a chat. Okay, Get Covered Illinois. Okay, I see that.
yeah, and
It's
if
certified by, okay, oh, yeah, I have one day.
you have one day.
Right,
And if you scroll
okay.
down towards the bottom of this page, keep scrolling down, it says broker office hours. Next office hour is today at 11. And there's a
Okay.
link for you to register to join the training. So they will go over more specifics and updates at 11 a.m.
So I want broker office hours. Okay, let me see.
And that's just like a webinar, just like we just did.
Okay. I don't see that. Let's see, where was I? I see where I would, oh, broker office hours. Okay, register here. Okay. I will do that. Okay. Oh, it's a good thing I asked. I don't do a lot of ACA,
Right,
but I haven't done any actually. But some people, are starting to get interested in it.
right.
And some people are asking me, they think Aetna is leaving the area because it's leaving Marketplace. So they think all of Aetna is leaving.
Yeah, I know it's confusing.
Have you had that too? Because I mean, my members that have Aetna Medicare are saying, well, Aetna is leaving.
Right. And I say, no, that's just the
Right,
marketplace for Illinois.
right,
Which
for
they've done
Illinois.
before, but I know with all the confusion, it's
There is there is so many questions and so much confusion. Okay, so I registered. Okay, and then do I have to do the trainings too before I join by today, or do I have a little time for that
no, you would have to do, to my understanding, from this page, get certified, it has to be completed by tomorrow.
by tomorrow? Okay,
Yeah. So you would have to log in to that Get Covered Illinois Learning Management System today,
okay,
and go through the training.
okay,
I think they said it takes 4 hours. It did not take me 4 hours. I think it took me
okay,
an hour and a half, but
okay.
been listening to all of Missy and Carrie's updates. So that's been helpful too.
Right, okay. And I probably, from this link, I can probably go on my computer and do it too, right? It'd probably be a lot easier
Yeah,
if I just do the Get Covered. I'll just take a picture of this. All right,
yeah. And if you do talk to folks and they're getting an email from Get Covered Illinois,
okay,
it's probably legitimate. I always have people double check. It should be directing them to go to Get Covered Illinois.
okay.
Um, and it will take them to this page if it's legitimate that looks
Okay,
like, hold on, let me share. It looks like this. Your healthcare starts here, and then in the middle it says got a letter from us claim your account. So they got information from federal, right?
right,
Moved to state for renewal purposes. And
okay,
so if they got that letter, they would have a unique code. So they can click here and
okay,
it basically just helps prompt them to set up their account with Get Covered Illinois and prepare
okay,
for renewal. To Missy's point though, we will still as brokers have access, but we may need to help reset up an account if somebody didn't claim their account, if you will. So,
okay,
if possible and they're computer savvy, certainly I encourage them to do this step, claim their account.
okay.
If not,
Otherwise,
we should be able to help course correct them as brokers when we enroll them for 20 shop.
but that's if we were already their agent, right?
Well, to Carrie's point, she recommends that you do a screenshot or make a list
Okay,
of your current book of business to make sure during the transition that those are getting assigned correctly. Uh,
right,
because you're not in the system yet
right,
as being certified, I don't know if their system would pick you up to walk those any clients of yours over at this point. But
okay,
certainly when you work with them on their renewal, you know, process that paperwork from your side, it should add you as a broker. Missy's on the board with the
okay.
Department of Insurance. So if you have
Oh,
trouble, you know, Missy Shepherd's a great resource. And then um, you can always reach out, you know, to Get Covered Illinois or us.
okay. Oh, I just got something, registration approved for that.
Mhm.
Get covered. So I'm getting some emails now. Um, so yeah, I guess I better get busy today, huh?
Yeah,
Between appointments, in between appointments, yes.
right?
You do
That's the
mostly
trick.
Medicare? You do mostly Medicare yourself?
So, after I left Health Alliance, I retired early and opened my agency. I've been doing Medicare group, Medicare individual, individual under 65. I added on because I had so many clients that were retiring early and not 65 yet.
Right, right.
And then I've got some small groups, mostly under 20, because my Medicare groups, you know, Medicare has to be
Yeah.
primary. So,
Okay,
yeah, I do a little bit of everything. On larger groups, I partner with other agents in most cases
okay,
because I was their Medicare group expert for so many years. So some of them I still
okay.
partner on. So yeah, I do a little bit
Okay.
of everything.
Yeah. Do you know Cherry Gordon Harris? She was with the Health Alliance.
Yes,
Yeah,
yes.
she's very sweet. I think she's starting her own company now finally too.
Did she? Oh, good. Because, yeah, when I retired early and made the switch, I mean, it was before I knew.
Mm-hmm.
And so I had no idea I was in business for a little over 6 months. And then I got the news and I went, what?
What? Oh no. I
But our
bet.
youngest graduated college and I had 4 grandkids and it was just time to pivot. So, um, but people called me and did you know? Did you know? I had no idea. I had no idea. It just the stars aligned in my life to make that change. I had been planning to do it for a long time and
Uh,
I'm just so sorry so many people, you know,
yeah.
are
I
disrupted.
was I was a Humana career agent, so something similar. Even though Humana didn't close, you know, they have no they don't have the career agents like they used to.
Yeah.
So they terminated us in 23.
Okay.
So in 23, we all the local agents here were terminated. So we all had to become brokers. So like you say, it's kind of a blessing because it forces you into doing something you would not have done before.
Right, right. And it gives us a whole new dimension to be able to help our clients, you know,
Mm-hmm.
where we were very siloed. And I was really
Right.
starting to feel that at Health Alliance, particularly I helped train brokers in 5 states. Well, Health Alliance is not a
Okay.
thing in every area like it is,
Right.
you know, in Central
Like,
Illinois where Carl.
right. Right.
So, you know, being able to pivot and say, really, you should take a look at this plan. There was only so much I could do
Right.
Health Alliance rep, but it was certainly a great experience and a lot of wonderful people, and
Yeah.
has helped me, and as
Where you're at now.
this group has really helped me develop and have
From
that
this group,
lifeline.
NABIP, you mean?
Huh?
You mean NABIP has helped? Is that what you're?
Yes, it's really helped because it helps provide that lifeline
Right. It
for
does.
you.
It really does.
Okay, Carrie, I ran into this problem. I know you've been doing this for years, or Missy,
Right.
forever. You know,
Right.
to to have that person I can call on,
Uh,
or this rep just called and wants to come into my office. Have you had any experience with this particular plan?
right. Yeah.
So
Yeah, it's good to have more connection. That's why I'm starting to get more involved as
it
I
is,
can.
especially
Yeah.
when we're such small offices. But
Right. Well, I'm an office of one. So,
yeah. Well, me too. I
Right.
have a receptionist I share with others that are in my building, and then
Okay.
mom works for me part-time for
Okay.
busy season. So
Yeah, I'm just by myself. So I work from home and then I have an office that that I can use. But I mostly work from home unless I'm meeting clients. And a lot of times I'm meeting at their place or,
yeah.
yeah. So do you do that at all? Go to their, or just come
I
to your,
I have a few.
right?
Since I have an office now, I
Mhm.
am encouraging everyone. I don't give them the option to go to their home unless they ask me.
Right. And that's what I'm trying to do too, is make them come to the office. But some people don't drive.
Hmm.
So, you have to realize that some people live in nurse. I do a lot of senior residents, senior housing. So I go there and I can do several people at one time.
Yeah,
I mean, have appointments back to back to back. So that helps too.
it does. And I've been doing that, and I only I have certain days that I do that on, so I'm not
Right.
asking for it. So yeah,
Okay.
yes, I can come to you. My travel day is whatever.
Okay. Okay. Well,
So
you're smart. You work smart. I'm gonna have to get into that.
because I tried that going back and forth, and
Mhm.
I didn't even know, like, there were some days where I thought they were coming to me, and I'm like, oh yeah, I gotta drive to them.
Right. I know. I'm trying to get more people, but there's so many that I have that don't drive.
Mhm.
On my first appointment today, they don't drive, so I have to go to them. So and
Well,
at their
they're
senior,
retired, most of them are retired, right, that are in
right?
that
Yeah.
situation, so they
Right.
typically can be flexible, and, I just try to group them in,
Right. Yes.
same days. So like this month for AEP, I have the 18th and the 25th are Saturdays, and my Saturday mornings are my travel time.
Okay.
And then the Monday,
Okay.
Fridays, I've got 9 to 7 in my office. So
Okay. But see, you do a lot of groups, so that makes it a little bit easier, right? Because you're just dealing
it
with
it
group.
does to a certain point. So Health Alliance had Medicare group plans. That was where I was the guru.
Right.
But there's not a lot of other carriers that offer the same situations. I'm having to rewrite them all into individual policies and
Okay.
put them into a MERP, which is an HRA, for the employer to reimburse them. But people are
Okay.
not loving that. They've got to pay the bill, turn the bill in,
Right.
reimbursed. But I am able, I work with the benefits attorney, to get
Right.
a contract so the employer can do that. Everybody saves money on their taxes, and I don't
Right.
charge them for it, because they've
Okay.
never been charged by Health Alliance, for that other
Right.
option. But it helps me
Right.
with retention, and
Right.
they have
Okay.
money, and they have to
Right.
administer it themselves, though. I don't
Right.
administer their HRA reimbursements.
Right. You don't do that. They have to do that
Yeah,
themselves.
I
Right.
don't I don't touch your money. I just give
No.
you the vehicle and you drive it.
Right. Yes. Exactly. Well, you have a lot of knowledge I don't have. I've never done any group or anything like that.
Well, when I started at Health Alliance, it was administrative assistant for the new sales team. So
Okay.
I had 3 kids, young kids. Uh,
Hmm.
I was going to school, night school, working full time, married, all that fun stuff. So yeah, I got to work in several positions at Health Alliance over the years that allowed me to
Okay.
develop, learn the terminology, develop the skill
Right.
sets and knowledge, and um, I was able to support all
Mhm.
different um, products and reps that did a lot of different things. So again, that's
Right.
very helpful for me
Right,
to start with that from the beginning. So
right. Well, good. Yeah. Well, thanks for your information. I really
yeah,
appreciate it. Yeah. Do I
no
have your
problem.
do I have your number? Was that on here?
I don't think it was. So
Okay.
my number's 217
And where are you at?
766
766?
9378.
Okay. And where are you at 217? Are you?
Oh, I'm in Champaign,
Okay.
Urbana.
Oh, okay.
My office is technically in Savoy, which is 1 block away from
Okay.
Champaign.
And then your name was
Sarah,
Sarah. Okay.
Sarah, SARA,
Okay.
at silverwolfinsurance.com.
Wolf Insurance. Insurance all spelled out, right? .com.
Right, because I had to make it as long as possible.
Possible, right? So you were saying that Humana is not showing any Carl doctors even in Peoria.
For Medicare Advantage,
Yes.
no, not that
Okay.
I've experienced. Aetna is
Okay.
showing everyone.
That
Uh,
is showing everybody.
Humana,
Humana is showing no doctors right now.
WellCare, no, but Humana, a
Now,
lot.
is WellCare a strong plan there?
So WellCare in Champaign County is a strong plan.
Okay.
The
Because here in
executive
in
goals,
Peoria, we have no there's no eye doctors that take WellCare because Bond closed. Illinois Eye Center will not accept WellCare, and then their dental network is just a Medicaid network. Is it different in Champaign? No? Okay.
well, I will say they have a plan that is, excuse me, I'm hiccuping.
Mm-hmm.
It's the WellCare Simple plan in
Right,
Champaign County, which is the same as in Cook County. So it's a very, um, it's a different plan than what is maybe available in other counties.
right, right.
Because it seems more specifically designed to win over those folks that were on the Health Alliance POS Choice RX.
Okay,
Dental, a lot of people liked with Health Alliance, they could go wherever they wanted to go.
right.
Get reimbursed up to $3,000 by Health Alliance. With WellCare, they have 5,000, and they have an in and out of network benefit. So if your dentist is not in network, then they'll
Mhm.
reimburse you up to 75%.
Okay.
And then they've
So
got,
they have to pay up front.
well, some dentists will file it for them. It really just depends on the dentist.
Okay,
Yeah, technically they should pay up front, but a lot of dentists
right.
are used to Health Alliance and they're 3,000, and so they like
Okay,
it all for them. Or if they do pay up front,
right.
file it for them so they get reimbursed.
So WellCare would pay up to 75% if they go out of network, up to 5,000.
For Champaign County plan, yeah.
And I know it's a POS plan in Peoria too. I just, I
Yeah,
guess I
they're
should,
looking through. It's the WellCare Simple,
is
not
it 009
it's WellCare Simple and Champaign.
HMO POS?
Yes,
Is the last numbers in 009 at all?
yes.
Okay, they have that same plan here. Um, yeah, they have that same plan here. But I didn't know they could go to an out-of-network dentist and get reimbursed 75%. That's good to know.
Yeah, and they're getting $53 a month on their OTC,
QC, right,
and Health Alliance was 35.
right, yeah,
So it's like
right,
they really were like
right,
upping, and I'm pulling up my sheet
right,
here
yeah.
for where's the dental page? So for vision,
So vision, they can go to Bond, but if they have anything like cataract surgery, they either have to go to Springfield, Chicago, like, but Champaign. So maybe Champaign is a good plan there
yeah,
because
Champagne, it's really been,
with Emporia, there's just if they want to drive, you know, to Champaign to get their, their cataracts taken care of or their then that's fine, but there's a lot of people that don't want to drive that far. So I bet it is a good plan there. If Illinois Ice Center would take them, it would be great.
And maybe they will in the future if so many people move over to it. It may.
We've asked and asked and asked, but they just, I mean, Illinois Ice Center, I don't think they pay very well or pay,
What
I
about
don't
the
know.
Humana Gold plan over there in Peoria?
Yes, it's a great plan.
I've
It's a
got-
strong plan here.
Okay.
But it's
I've
not a
got several
POS, so
Medicare
they
groups.
have to go to an in-network dentist, but there's
Okay.
there's a big network of dentists that take the Humana Gold Plus.
Okay, good.
A lot of dentists take it, so and then Illinois Eye Center is in network, so that's the plan I like here in this area. The Aetna plan isn't bad either. The Aetna HMO, though, they kind of destroyed that plan this year. They took away a lot of the benefits.
Yeah.
They took away their OTC. The dental was greatly reduced. They had an extra wallet card. They took that away. They took a lot away. So I think Aetna is hurting, but
Yeah.
and we're
They
not
took
getting
a lot away here too.
and we're not getting commissioned on any Humanic PPOs. I don't know if you are there,
No.
but all the PPOs are non-commissionable.
No, and they have a $750 medical deductible here on their A and
Right.
B. So it's just
Yeah.
with WellCare plan being available and the Humana and WellCare both being in the same boat of
Right,
going up.
right. Do you have the HMO Gold Plus with Humana there? It's not there? You don't-
I don't think so. I
Okay,
haven't a whole lot of it, a whole lot of those lately.
okay.
Because it's not been a thing. I had one person that wanted to take it if Carl doctors, they're committing to Carl doctors because she only goes once a year for preventative and she wants the buyback,
Mhm.
which is what, $70 some for Part B for that
It'll
plan.
be 71 next year, but we can't even sell it next year. Well, we can, I guess, we just don't get commission. So we can sell it, but it's uncommissionable.
Yeah.
And so is the 399. So but there's one PPO that is commissionable. I don't know if you have it there, but it's a $60 premium.
Oh, yeah.
Yeah. So
I
it's
haven't
gonna
seen
be
that one, but here,
okay.
yeah, WellCare has really been shining along with Aetna. But Aetna, yeah,
Okay.
they modeled their plans so it's not as rich and competitive, anywhere near as rich and competitive as what WellCare is offering. But
Okay.
it's the safety school. It's
Right.
you have the doctors
Right.
network. It's a $5,500 out-of-pocket maximum for A and B. WellCare's $3,900. I think
Right.
rental's 2,000, with a network where WellCare is 5,000. I mean,
5,000.
they just beat the socks.
Right.
WellCare just beat the socks off everybody with those benefits here on purpose.
Right.
Sure.
Right.
You
I'm
know,
sure. And I haven't had anybody use that dental on a network, so I don't know how that works. I'd be very curious to see if that was good. Because other than Illinois Ice Center, it is a good plan. But you never know when, because I have somebody leaving WellCare this year to go to Humana or Aetna because he wants cataract surgery. And he doesn't want to have to go to Champaign. Because
right.
they have to stay overnight because they have to go to the doctor the next day. Then they have to go back in 2 weeks and do it all over again.
Yeah.
So that's, Springfield, Chicago, Champaign, that's long, that's for somebody living here, that's a lot,
Yeah.
So, but and we keep asking, please get Illinois Accent in your network and you'd be great, but so far, but I'm glad it's a good plan there. In fact, there's a lot of agents here that don't even sell WellCare because of it. No, they're not even contracted, so it's good to know that it's
I didn't contract with them either until this year.
okay.
Because I was so put off by what happened with them stop paying commissions last year and
I know.
had the first domino that fell, right? For not
That
paying.
was the first domino. I
And
know.
so I purposely stayed away.
Yeah,
I didn't need them at first because health
right,
in my
right.
was
In your
king.
market, right.
So
I have to get my PDP sold before November 9th though for Humana,
Mhm.
I
Yeah.
know. So I don't know. I just don't wonder about our business. I really do. Are we gonna,
Too.
are we gonna survive? I don't know.
I do
know.
too.
Thank goodness for NABIP, fighting for us. That's why I'm
NABIP and
part of it.
NAPA and the Big I, yeah, we're all joined
Right.
together. I just,
Mhm.
it's gonna take our clients filling out
Right,
surveys, calling their elected
right,
officials to
right,
say, I need my broker, I need
right,
an agent, I don't
Okay.
want a call center.
right. I know, I need to have my clients, I need to give them that
Yeah.
letter. They just mail it in?
So there is a mailable version, but for those that don't do the internet, but there it's a link that they can click.
Okay. I have some very savvy clients and I have some very unsavvy clients.
Right. There
You
is
know
a
what I mean?
mailable version. I will have to
Okay,
go back and see where that's at though, but they're, you
right,
know, it's, and they can always just write a letter.
right. I
you
mean,
know.
they have some people that can use a computer and are just surprise the heck out of me. And then others that, haven't, they use their phone and that's all, and they don't feel comfortable even with that.
Yeah, if they text it to you,
Right.
write it down on a paper for you and give,
Okay,
you can always scan it in to me or
okay,
and we can put it into the system too.
okay.
So,
I'm gonna, I am, yeah, I need to. Okay. Well, yeah, I think that's really important. I tell everybody, get involved with NABIP,
yeah,
because this is who's fighting for us.
yeah. You need people who are gonna be in the rooms we're not in.
I know, exactly.
Yes.
And so even though I don't go to as many of the meetings as I do, I'm gonna try to hop on these when they're Zoom. But I
Right.
know, yeah, because you're in Champaign, so I know here in Peoria, but they changed the location, which will be a better location for me. So that's good for next year. Yeah.
Yeah, when I was a Health Alliance rep, I came to Peoria almost every month for the meetings because I traveled anyway, right, to visit brokers.
Right. Yeah.
So
Right.
it
Right.
wasn't a problem, but now with my own business,
Right.
it's a lot harder to always get away because it's a good 3 hours in the
I
car plus
I know.
3 hours
Right.
for the meeting, so you're pretty much gone all day. So
Right.
this time of year, I
Right.
have a hard time doing that, but
Mhm.
yeah, I like to join the virtual meetings too.
Yeah.
But yeah, it was great catching up with you, Cindy. And
Join.
you've got my number if you need me, and
I
I'll
do.
be
I have your number, and if I right be seeing you. So yes, and if I have any questions, and if I can reach out, I'd appreciate it.
yes,
Okay.
absolutely.
Well, it was nice talking to you, Sarah.
You
All right.
too.
Bye
Thank
bye.
you. Bye
Bye
bye.
bye. Bye.